We've all been there. A little slip of the knife in the kitchen, a stumble in the yard, and yeah, most of the time we just patch ourselves up and get on with it. But how do you really know when that small injury actually needs a doctor? That's what we're going to figure out today, when a minor injury isn't so minor after all.
So you get a little cut, you wash it, stick a bandage on it, and you're done, right? Or you graze a hot pan, run your hand under some cold water, and that's that. But is it always that simple? What's the real tipping point between I've got this and, uh-oh, maybe I need a doctor? That's the critical question we're diving into.
Okay, so let's start with what we'll call the everyday injury problem. The thing is, precisely because this stuff happens so often, it's easy to get a little too casual about it. But as you'll see, ignoring what looks like a small wound can sometimes lead to some much bigger issues down the road. And we're talking about the greatest hits of household hazards here, aren't we? Scrapes from a fall, a burn from the oven, a painful little skin abscess, or that splinter you just can't not get out for the life of you. These are the exact situations where knowing a little bit more can make a huge difference. Now, this is really important. It's not just about the injury itself, it's also about who gets injured. For kids, the elderly, or someone with a condition like diabetes, the body's healing process is just different. The risk of something like an infection is way higher, and all of a sudden, that tiny cut isn't so tiny anymore. All right, this is the heart of it all. We're moving from the what and why to the when. This next part is all about giving you a really clear, simple checklist to turn that feeling of uncertainty into confident, decisive action. Think of this as your red flag list. First up, bleeding that just won't stop with pressure. That's an immediate sign. Then you've got signs of infection, redness, swelling, or any kind of discharge. A burn that blisters, especially on sensitive spots like your hands or face, that's serious. And if the pain is really bad, or it's just not getting any better after a day or two, yeah, it's time to make the call. And this lays out the dividing line perfectly. Over on the left, you've got your minor scrapes and bruises, the stuff that basic first aid can usually handle just fine. But the column on the right, these are the game changers. Persistent bleeding, signs of infection, deep wounds. These are clear signals that your body needs a bit more help than a bandage can give. So, let's say you've spotted one of those red flags and you decide, okay, I'm going to see a doctor. What actually happens next? It can sound a little intimidating, but the reality is often very simple and straightforward. Let's pull back the curtain on that. This chart breaks it down so well. Got a deeper cut? The doctor will clean it properly and might use stitches or a special skin glue to close it up. Have a nasty abscess? They'll drain it safely to get that infection out. For burns, it's all about proper cooling and special dressings. And if there's any risk of infection, they'll clean the wound thoroughly and maybe give you some antibiotics. It's all about safe, sterile procedures to help you heal faster and better. Okay, you've seen the doctor, you've been treated. What now? Let's talk about the next steps, healing and aftercare, by tackling some of the most common questions people have. This has to be the number one question, right? You've got a cut that looks a little gnarly, and you're staring at it, wondering, is this stitch-worthy?
And the short answer is nope, not always. Stitches are really for wounds that are deep or gaping, where the edges of the skin just won't stay together on their own. Closing that gap is what helps it heal cleanly and keep scarring to a minimum. All right, another classic scenario from the kitchen or the barbecue. You've just touched something way too hot. What is the absolute first thing you should be doing, even before you think about calling anyone? It's simple. Cool, running water. And not just for a second, you want to keep it under the tap for a good 10 to 20 minutes to really pull the heat out of the skin. And here's the crucial part. Do not use ice. The extreme cold can actually cause more damage to the tissue. Just cool water. The dreaded abscess or boil. It's painful, it's gross, and man, is it tempting to just hope it'll disappear. But will it? Well, sometimes you might get lucky with a really small one, but for the most part, an abscess needs to be drained by a professional. Trying to pop it yourself can actually push the infection deeper into your body, which is the exact opposite of what you want. We always think about tetanus shots when it comes to stepping on a rusty nail, but what about a simple cut from a kitchen knife or a scrape you got while gardening? So this one really comes down to two things: how up-to-date your shots are and how you got the wound. If it's been more than 5 or 10 years since your last booster, or if the wound is dirty, say it has soil or gunk in it, a doctor will probably recommend a booster just to be safe. So, how long until you're back to 100%? For most of these common little injuries, you're looking at a healing time of about 1 to 2 weeks. Of course, that's just a guideline.
A deeper wound or one that gets infected is definitely going to take longer, which is why getting the right care from the start is so important. Okay, let's wrap this all up. What are the big things to walk away with? First, getting seen early can prevent bigger problems like infection and scarring. Second, really get to know those warning sounds we talked about. Third, don't be scared of getting professional care. It's usually quick, simple, and makes a world of difference. And finally, remember that what you do after you see the doctor is just as crucial for healing well. So I'll leave you with this final thought. We all have a first aid kit with bandages and antiseptic, but maybe, just maybe, the most important tool in that kit isn't a thing at all. It's the knowledge of when to put it all aside and let a professional take over. Thanks for joining me.